Hey everyone, Dr. Rodman with Sports Chiropractic. If you have chronic lower back pain, this is a great exercise for you. Also, if you notice a lot of times when you do lifts, your back arches or extends, or if you feel like just even when you're standing, you have kind of one of these positions where there's a lot of extension in your lower back, this is a great exercise for you. As we've talked about recently, we have a muscle called our transverse abdominis. It's our internal weight belt. And what it does is it holds our spine still and sturdy throughout the day. When this muscle is weak, a lot of times people will say their back goes out or they have a back spasm and they get that kind of real tight position. So the stronger this muscle is, the more tight that internal weight belt is, the less likely you are to have a flare-up of back pain. So a lot of times you'll notice if you lay on the floor, if your transverse abdominis is weak, you will not be able, if you put your hands under your lower back, you should feel a little space. You should be able to flatten out that space. And that is activating your transverse abdominis right now. So that's a simple exercise. If you want to start with that, just put your hands here, try to flatten that out, and just see if you can hold that for a minute. If that's really easy for you, what I would recommend is getting a ball. These are awesome for so many things. And what you're going to do is like a negative, or you're going to try to slow the motion down. Putting your hand back in that space right there, trying to flatten out that's your lower back onto your hands while you're bringing that ball down, keeping that your lower back pressed upon your hands. And I feel right here, this level, my back wants to arch. So what I'm gonna do is I'm gonna start over, really focus, and I'm gonna concentrate. I'm gonna hold this tight and really try to fight that wanting to arch. Bring it down as slow as I can, keeping that back flat. It's hard, just hold that contraction. And just every time you feel it want to arch, you try to reset and you try to flatten it again. And then once you get to that point where it's pretty low and you feel a lot of tension, just hold it like a plank almost. See if you can hold it for about 30 seconds, keeping that flat, and then slowly going down, keeping that back flat the entire time. When you do that, a lot of times it'll feel really hard because most people have never activated that muscle before. But it's probably one of the most important core muscles that if it's weak, you're gonna have chronic lower back pain. You can try to do everything else to fix it, get massages, get adjustments. It will never go away until you turn that muscle on and strengthen it. So a little bit about the transverse abdominis today. One of my favorite exercises to fix that. Dr. Rodman, have a great day.